74-year-old male, abdominal pain, on imaging, a very dilated bile duct, no definite stone. He's post-cholecystectomy and referred now for EUS and evaluation and mild elevation of his liver enzymes. So here you can see right in the middle a stone that's floating, and we'll mag up a little bit here and we'll measure the size. So it looks to me like this is a single stone. Here we go. So it's under a centimeter, 0.8 by 0.5. So an oval stone with shadowing. And we'll just check to see if there's another stone. Maybe. So there's one. And I'm going to turn, and I think there's another one here. I think this is a different stone. Yes. So there are two stones. Okay. And this one is about the same size. So let's just confirm that. And there's a possibility that there's a third one here. So this could be a third. I think this is a third one. So I think we're looking at three stones. So here. And this one is 6. So let's start at the very bottom and slowly turning 1, 2, 3, 4. 4 stones. All right? That's the one we started with. 1, 2, 3, 4. I think 4 stones. So we'll count them when we remove them. So we know there are multiple stones. All right, we'll follow this down to the ampulla. This way. And there's the cystic duct takeoff. And he's post-cholecystectomy. So we'll go a little further in and take a look at the ampulla. Slowly pull back. And we'll get some water ready just to give a little bit of water. I always like to get a good definition of the ampulla. And one moment, not yet. And let's first wait till we see the PD. Okay, so here we have the PD. I think these are side branches, you see, right? And we'll pull back a little bit further to see the bile duct. And that's coming right above it. And I think there is, can you mag up that little wheel? Yeah, turn one more time. So let's see what happens when we put some water in. Because I see some echogenicities there. I think that's gas in the diverticulum. Go ahead. And we'll just see whether the fluid fills that, and it does. Right? So this is the way we demonstrate a diverticulum. There it is. Right? And we can fill that up nicely. And we need one more. And we'll measure the size of the tick. One more time. And you can see there's probably some food residue in there. Okay. And I'll measure this out. So this is the diverticulum. 1.4, okay, with some food. All right, now we'll look at the bile duct. So you see the PD below and the bile duct above. I just want to make sure that there isn't a stone impacted at the ampulla. There usually is not when you have a diverticulum, and the bile duct is being compressed right now, so I'm releasing that compression and just slowly pulling back like this. And then we start to see the stones. So there's one, right? So it's coming into view. There's that one, floating one. And we know now that there are several. So there's another one there. There's another one. And there's the third one. And I think we counted 4 before. So let's see if we can get that 4th one. I think it's kind of coming there, here. So sort of iffy with the 4th. Doesn't matter though. So 3 or 4. And then we dip down to the common hepatic duct here above the takeoff of the cystic duct, which is right here. You see the takeoff of the cystic duct. All right, we'll go now to ERCP. Ah, yes, there's our tick. We saw it. And we saw also the fluid inside with EUS. Okay, so let's, it's on the rim. That's the good news. So we'll cannulate with the ultra-tapered sphincterotome. Okay. And we want to aim high. And we also take a look and see the course of the bile duct, where you see some bulging there, so I know the direction to go. And when you have a tick, it's often not really so much caudal-cranial. It's actually sometimes going down. And I just have to adjust my angle a little bit and just sort of see where I sometimes lift a little bit. This over a little bit more. Yeah. Patient has hiccups, as you can see, so we'll just sort of see what slides in. It just slid in. Let's aspirate.
Aspirating.
Ah, looks like bile, doesn't it?
Aspirating.
All right, so we'll just wait till we really get bile back.
Aspirating. Aspirating.
Okay,
Aspirating. I have bile.
very good. And
Live up, please. Oh, no, we're not
doing it, that's why I was confused.
yeah, we're going to do a sphincterotomy now. All right, so we're going to now do a sphincterotomy. And let's blow up a little bit. Using pure cutting current, we'll just tap a little bit with just the end of the wire. That's good, blow down. When you're dealing with a tick, you have to be very careful. Now we have a few stones, so, but this is a tick. And the stones are less than a centimeter. Let's blow up, and now I'm just going to gauge with the bowed wire whether this is sufficient. I think it probably is. No. Okay, go down a little bit. I'm going to cut just a little bit more, but just with the bow down, please. I'm not going to bow at all, and I'm just going to cut here. Okay. Now let's try this one again. Bow up about halfway, please. Just want to see how much space. Yeah, I think this is going to work now. Yeah, this will work. Bow down. All right, basket, please. So I'm going to cannulate now with the dormia basket. And you can see it's nicely closed. And we'll impact right here where the opening is and drive it up into the duct like this, lifting and going in. I'm only going to go in a little bit like this, and we'll open the basket now because I don't want to capture too many stones, and see if I can sort of pull at least one of the stones down with just suction. That you can see I'm doing that now. And I want to find that sweet spot where the basket wires opens up the orifice to the bile duct maximally. I'm trying to determine where that would be, maybe coming now. So the basket was not designed to be used as a net. That's how I'm using it. So I really want a basket that opens up a little bit more, wider. I'm just sucking the bile now and just slowly pulling back. And we'll see if we can get at least one stone. So you always want to catch the lowermost stones first. So now we're opening up the bile duct very nicely. And I'm getting a little bit of resistance, suggesting that maybe I've got a stone. So this is where you can see I'm slipping above the papilla. I'll have one of the assistants hold the scope. I'm going to try to get a more caudal cranial orientation so that I'm in the axis of the bile duct. That's what's critical. In the axis of the bile duct, and then slowly pulling back. I'm anchoring the sheath at the biopsy port and slowly turning to the right. As you can see the stone coming now, and I'm just going to tease the stone out. Now, one moment. want to look and see how many stones I've got. I think that's just one. We'll see though. I think that's just one. Okay, it's a little irregular, but it's one. Let's get a little bit more light. All right, so let's go close and go for the next one. So if you catch a stone above the lower stone, then you could easily impact the stones. So let's now open again, please. All right, and we'll see if we can get the next one. And same technique. Now you can see there's like a little piece there. It's maybe a little bit of what we were seeing. So again, sucking. So there are little pieces of the stone there. I didn't crush anything, but so I feel resistance again. So once again, I'm turning slowly to the right. If you could hold that, turn to the right, please. I have an assistant actually doing that for me because I want to be able to keep things in the axis of the bile duct. And now I'm just going to slowly turn. You see it coming? There it's coming. All right. Now maybe 2 stones this time. I don't know. We'll see. Let's look at it. I think this is 2. Yes, see, we got 2 stones. One of them is sort of breaking up. But I really think that's 2 stones. All right, close. Basically, we just want to match the number of stones we saw with EUS with what we're pulling out of the bile duct. All right. Okay, now open again. Okay. So the key is the section, and as we're sectioning, kind of hold it there, the scope, and trying to stay below the ampulla if possible, and then I'm waiting for that spot where the basket really opens the duct up. Sometimes I'll kind of jiggle it back and forth like this. I think I'm getting the next stone now. And then I tease it out by turning to the right, like this. Turn to the right for me, please, while I pull the basket back. I have resistance, so I know I've got a stone coming. It's going to pop out in just a moment. And there it is. Okay, now let's look at this stone. If it's 1 or 2, looks like it's just 1, right? So that's number 3. Or number 4. Well, let's see if we have another one then. Close. See, that's why you need your assistants to count. Because otherwise.
We got 1 and then we got 2 in 1 shot. And
all right. All right, now let's see. We're going to go in a little further. And we'll open the basket now. I already have a good feel how far into the duct I am, but basically 10 centimeters is the distance between the ampulla and the bifurcation. Open? You're open all the way? Okay, so we're going to do one more sweep with suction and see what comes. And then we'll do the flush and gush. So again here, now this time I don't feel any resistance, so I don't think there are any more stones. I would expect, you're not catching the stone when you open the basket, you're pulling the stone down into the basket. See, there's nothing. So, all right, now we're going to go in, and this is where on the biopsy channel, I'm going to measure 10 centimeters. Give me the ruler, please. And I'm going to advance this in 10 centimeters to the bifurcation, all right? So let's see where the 10 centimeters, please. Do you have 10?
Yeah.
Okay, there, I've got it. All right, so let's, can you advance this for me? So, because it's buckling. So just advance it in. I'm holding where 10 centimeters is, and I'm making sure that it's going in smoothly and easily. Now I'm 10 centimeters in. 20% opening, please.
20% open.
Flush.
Flushing.
And let's see
Flushing.
if we have a gush.
Flushing.
Okay, that's gushing out very nicely. Very nicely. All right.
Flushing.
All right. So it's what, about 20 cc's or so that you flushed?
Yeah.
20? Open all the way?
Open all the way.
Good. And now we'll do one last trawl. And don't flush anymore. Just, the basket's all the way
All the
open?
way.
Yes, okay. So no more flushing needed. And now I'm just going to hold it right here, suck out all of this. This is the net to pry open like a ampullary speculum or something, just to open it up. Just sucking, sucking, sucking. Okay, so now I'd like to actually demonstrate, it's not necessary, I'm very convinced I have all the stones out, but give me the mini probe. And the first thing I'm going to do though is I'm going to fill the bile duct with lots of water. So we'll just flush a lot of water in here to get all the gas out. And then we'll use the mini probe just to confirm that we have no residual stones. It's very optional. And I only do that when I'm concerned that I have a discrepancy between the number of stones I saw and the number of stones I extract. So I've attached the bioshield, which allows me to infuse water alongside an inserted instrument. And I'm inserting the intraductal mini probe. It's very thin, very fragile. So it's important to advance it in short increments, holding the mini probe very close to the biopsy port as I advance. And you can see I'm submerged in water. I've filled the bile duct with water as well, so I have an acoustic environment for the coupling. And now this part you must be very careful using your elevator, and don't excessively use your elevator. I'm going to give a little bit of water here. All right, so there's their sphincterotomy. And I do feel it going in very smoothly now. There it is, it's sliding in. 10 centimeters, do we have that? All right, we're going to advance to 10 centimeters. Right, that's very good. Okay. All right. And slowly advancing. Okay, now let's turn the ultrasound on, please. In this case, with the ultrasound, we can see how far we're inside the duct. I definitely don't see any stones here.